So now that we have our problem list developed, how do we tackle each problem with exercise and self-mobilization?
My name is Adam, proud father, married to an amazing woman, fitness enthusiast, registered physical therapist. This channel is dedicated to those busy parents trying to figure out how to perform at their best in this crazy game of life. The information in this video is for educational purposes only.
So we've got a few things that could be occurring. A lack of thoracic mobility, so the area of the spine between your neck and your lower back. If that area does not move adequately, more specifically bending back and rotating to the side, if you don't have that movement, then it impacts the ability for your shoulder blade to stay where it should be and move the way it should. So then we have your shoulder blade. Now, exercises that target the muscles that help to keep the shoulder blade in place, but also help to move the shoulder blade as the arm elevates. Those exercises can also be done to help facilitate better scapular movement. Then we've got stretching of certain muscles that will pin that shoulder blade down, maybe potentially bring that shoulder blade forward, causing that poor posture. Maybe it's your posture that is actually causing these muscles to get tight. So we have to be able to loosen those up and lengthen them. Lastly, training the rotator cuff muscles to do their job. The job of the 4 rotator cuff muscles is to keep that head of the humerus, so the ball, in the socket while the bigger muscles move the arm around. All right, so we'll start first with thoracic mobility. There are a couple exercises that really are effective, especially using a foam roller. If we're targeting thoracic extension, you want to place the foam roller perpendicular to the spine in the mid-back. We can place our hands behind our head or over our chest. Then we want to tuck the pelvis so that we don't overuse the lower back. And all we want to do is pivot around the foam roller. So we're using the foam roller as like the fulcrum. So we're going to extend back. We could even have the arms extended. It's okay to feel a crack and a pop every now and then. Sometimes our joints are just filled with gas and they need to be released. So first, we want to make sure that we flex a little through the lower back, just to lock out the lower back so we don't start rotating through that area. Then we want to lay flat, have our shoulders flat on the floor. So our upper back should be flat on the floor. And then we could have that arm in a 90-degree externally rotated position. And just allow the pec muscle, the muscle at the front of the chest, to release. At the same time, getting some rotation in the upper back. We could also perform a thread the needle movement. We could also do a lumbar locked rotation. Arms in, hand behind the back. I like using a wall as well, because using the wall provides feedback as it pertains to your body position. We can use the wall to improve thoracic mobility. We can also use the wall to determine our posture. So having our backs up against the wall, head touching the wall, arms at 90 degrees, externally rotating, trying to get the back of your hands to touch the wall. And this provides feedback on whether or not the muscles that internally rotate our shoulders are tight. And we can go up and down. This is a tough one. There are many people that can't do this, and it doesn't mean that you have an issue. However, if there is a problem with your shoulder, chances are if you improve that mobility, you will have less discomfort and pain in that shoulder. This is an exercise that I really like. This is very similar to the Y, and you're doing one arm at a time, focusing on that lower trap muscle, and you can load it using a weight. So we're gonna get into half kneeling. You're going to hinge forward. We're gonna bring that arm up on a scapular plane. So it's on a 45 degree, it's not out here, it's not out front, it's right in the middle. And then all we're gonna do is come up and down. We still have to talk about our rotator cuff muscles. The best way to work your external rotators, the two posterior cuff muscles, the muscles at the back of the shoulder that externally rotate the arm, is to lay down on your side, keeping your arm nice and tucked in by your side in contact and rotating up. And you can do this holding a weight. The reason why this is so effective is because when most people do this standing with a resistance band, they end up lifting their arm away from their body. Instead, what we need is to keep our arm close and tucked in, bring our shoulder blade back. Gravity allows us to do this in this position. So you're just gonna tuck it back and then rotate up. Nice and slow on the way down, and then rotate up. For the supraspinatus, which is also one of the rotator cuff muscles, getting your shoulder blade back and doing what we call a full can scaption. Scaption just means you're moving in the scapular plane, midway between the front and the side. So right here, and all you're gonna do is raise it up and come back down. You wanna use a light enough weight for this movement. This exercise is specifically for those winging scapulas. So remember we discussed in the assessment, if your scapula, your shoulder blade, seems like it's just popping off of the back and you can almost fit your fist under that bone, then your serratus anterior muscle is likely weak or inactive. Now, we can do this without a resistance band, but I'm just gonna show you the progression. This is what we call a push-up plus. All you're going to do is move the shoulder blade forward and back. You're sliding the shoulder blades along your rib cage. So it's like you're dipping your chest down, then you're pushing yourself away. So there you have it. You've got a self-shoulder assessment geared towards someone who may potentially have a shoulder impingement. We talked about thoracic mobility, the mobility of your mid-back being very important. Talked about the stability of your shoulder blade and your shoulder blade's ability to move the way it should. We also talked about the strength of the rotator cuff itself. If you have discovered your main problem list, then you can pick apart this program, and the goal is to check off the problem, make the problem not an issue anymore, and hopefully your brain no longer perceives threat in certain movements, especially those overhead movements. We can hopefully decrease the inflammation and irritation of the tissues under the roof of the shoulder. We'll be able to provide some level of strength and confidence so that when you do things overhead, you're not feeling a lot of pain. So we're basically trying to desensitize the tissue in the area. If you like this video, if you feel like there was value and maybe there's someone that can benefit from it, please share it with anyone who you think can benefit. Hit the like button and please subscribe to this channel so that I can pump out some more videos that can help more people. Till next time, this is Adam Chang signing off.